He did the most miraculous implant on me. You can't tell which one it is. It's one of these two major front most visible teeth. You will never know which one it is.
Well, patients need implants because they have lost a tooth or need to lose multiple teeth. An implant is a great replacement for a tooth that can't be rescued, and it feels very much like a natural tooth.
My dentist said there's only one person you should go to deal with this. There are lots of people who do normal dental surgery of this type. There's only one real specialist, and that was Scott Kissel.
If you were sent to our practice for a dental implant, your doctor knows we have a long-term history of successful implants in our practice. It's not as simple as creating a space in the jaw and placing an implant. It doesn't guarantee success. A lot of factors need to be considered in order to have a successful long-term result. So here, we pay great attention to the environment around the implant. The gum tissue, the bone, positioning of implant, these are all really important factors. A lot of the products we're going to use here are going to be top-notch products, but there's a reason for that. This is your health. And it's important to have well-researched materials and the best quality implants possible. And we take great care in how we plan cases. Implants are much more sophisticated than most people think. And there's a lot of planning that has to be done to make sure everything is proper and they have a great long-term success. And at the end of treatment, we test our implants to make sure that we're sending back a product that's successful and that's something that you can depend on. And then doctors know that's what makes our practice special.
It was microsurgery, meaning that there was minimal invasion to the bone, to the surrounding tissues, minimal recovery. And I walked out the door after a procedure, the first procedure with a temporary tooth, that looked perfectly normal.
The smile technique is a very interesting technique. It was developed by my mentor, Dr. Dennis Shanilak. It's a microsurgical technique where a front tooth, or it could be any single tooth, is replaced with an implant that day, and the tooth is connected to the implant that day. So you basically walk out with a tooth. There are a bunch of steps within the smile technique to have an aesthetic result, and the microsurgery is just critical for that because I am able to work through such small spaces and achieve these steps with no insults to the patient. The best way to plan implants is to plan it three-dimensionally on a computer, where you have a virtual mouth on a computer. And so there you are on the computer, your gums, your jawbone, teeth, and we can then map in your nerves and blood vessels and look at how your bite comes together. And on the computer, we can plan your implant placement. We can magnify the image and see it so precisely that we're able to place an implant in the very best position that's achievable. And from there, we have in our office a three-dimensional printer where we will then make a guide that will guide us during the implant placement. It's similar to, say, an appliance, like a retainer that we use just for that day to place the implant. If your implant's in the very best position, you're going to have an exceptional long-term result. So when you come to the office, in order to make this all happen, we're first going to take a three-dimensional view, a cone beam x-ray, similar to like a mini CAT scan, and we combine that with an optical scan. We have a little, looks like a wand that goes in the mouth, and it takes photos of all your teeth and the gums, and we merge that with the bones, and we have a virtual you on a computer that we can spin around and manipulate all different ways. We have really sophisticated planning programs. I've been doing this for 20 years, three-dimensional planning. I'm the one that designs it. It's not a lab technician who's designing it. We customize the guides. They're not typical surgical guides. They're customized in a certain way, so to gain the most accuracy. In the profession right now, there's a big problem with implant success called peri-implantitis, where you lose bone around implants. And that happens primarily because the case was not planned properly. So here what we're going to do for you is we're going to evaluate all these different factors, make sure we're setting up an environment for success. It's important that we limit the risk of peri-implantitis. Certainly an implant has to be cleaned on a regular basis at home. And we carefully show our patients different ways of doing that. Because one method may work for one patient, may not work for another patient. We have to make sure, obviously, the patient's medical condition is such that it's conducive to placing implants and also for the long-term success of implants. So you may have consultations with your physicians. The structures around an implant, the bone, the gum tissue, all have to be properly analyzed and, if needed, treated so that we have successful implants. It's not as simple as just placing an implant in the bone and then saying, okay, this is going to be a successful implant. You need a certain type of gum tissue around your implant. That has to be in place. You need a certain bone thickness around your implant. That needs to be appropriate. We test the implants once they have integrated to bone to make sure that the implant is well integrated. And at that point, that's when we send the patients back to their doctors. You'll come in, we'll get these scans, we'll sit down, have a conversation. I'll review with you and answer all your questions about anything. And I'll review with you the different options that you have, and you'll be able to ask me any questions, and we'll go through all the questions. It's not going to be a rushed appointment. We set aside a fair amount of time for this so that you'll feel comfortable, I feel comfortable knowing that you're comfortable. You tell me what option you would like to pursue, and we make that happen for you. If it's as straightforward as using three-dimensional planning and placing an implant that day, you're going to leave without any discomfort or swelling. If you need multiple implants placed but doesn't require any bone grafting, then you will leave without any discomfort or swelling. If you have the need for bone grafting, you will have swelling, and sometimes advanced swelling, but you don't typically have a lot of discomfort because we're very careful in how we handle tissues. So in general, the majority of procedures related to implants, the patients are pleasantly surprised that night that they have no discomfort or minimal discomfort.
You can't tell which of my two front top teeth was built by Scott and which was built by heaven.
It's really amazing for me to see this happen in the patients and to be able to provide this service. I'm always amazed what the body can do, how it can heal itself. If you set things up in such a way and you're so minimally invasive to the body, what the body can do, it's fascinating, it's amazing.